Hello, Dr. Prajwal. Can you just explain to us what are the surveillance or follow-up recommendation if a patient is already having liver cirrhosis?
So every 6 months it is recommended for a diagnosed patient, already a patient who is diagnosed, to undergo a serum AFP levels, alpha fetoprotein levels, and the serial monitoring of this will help in assessing where the patient is at the time of treatment. Also, a regular ultrasound abdomen once in 6 months should be good enough to assess that. Along with that, we have to as clinicians, our primary thing will be to assess him clinically. Head-to-toe examination, worsening of jaundice, anemia, correcting nutritional status, ascites, other comorbidities, psychosocial health, all of this matters along with this screen.
Also, let us know what is the current vaccination guidelines for hepatitis B across the globe.
Yes. So when it comes to hepatitis B vaccination, it is said that about 300 million people are chronic, active or inactive carriers of hepatitis B. Now that's a huge number. So when we are vaccinating such a huge number in terms of the government level, it comes with its own financial strain on the government. So because of that, we need to first identify who's the target population to get the vaccine. So it is said that anyone who is less than 60 years of age, irrespective of the risk of exposure to hepatitis B, is at risk. Other than that, special populations who are HIV positive, HCV concurrent positive, and who are on dialysis, say for their renal failure, on CKD patients who are on dialysis, and of course infants, whether the mother is positive or not. These are the target populations. So let's talk about the adult vaccination schedule. So the adults have to be, the recombinant DNA vaccines, which have been very efficacious recently and have been widespread use. The costs have been coming down. So the schedule includes at 0, 1 and 6 months. So you get one at 0, 1 ml intramuscular injection. You get 1 month later, that is 4 weeks later, and 6 months from the 0 dose. So these three things is sufficient in more than 99% of the general population for a lifetime cover. They do not need a repeat one. Unless we consider there's an ongoing risk or poor responders, we may have to repeat a titer. When it comes to healthcare workers, it's a special scenario. We are daily exposed to such patients and the risk is much more than even HIV infection. So we need to repeat titers at least every 5 years. Less than 10 milli international units per ml, we may have to undergo a repeat booster dose or a complete series of vaccination. If the patient is a special category, as I mentioned before, then the 3 schedule becomes a 4. So it is 0, 1, 2 and 6 with regular titer monitoring.
Thanks a lot.
Thank you.